We've heard it time and time again, being a healthcare professional is extremely stressful, especially these days, and has always had its stresses which can overflow into patient care. Joining us with something to cheer up our medical workers is Dr. Greg Hammer, author of Gain Without Pain, the Happiness Handbook for Healthcare Professionals. Doctor, thank you for joining us.
Wonderful to be with you.
So, first of all, I'm curious what inspired you to write this book.
I've been involved in wellness directives for quite a while. We formulated a WellMD group at Stanford in response to the growing pandemic of physician burnout. I think burnout throughout the healthcare profession in general. This was well prior to the pandemic that this came across everybody's radar screen. And I was invited to give a talk about wellness and burnout, and one thing led to another, and pretty soon I'm talking about wellness a lot more to groups of physicians than I am about my medical research. So I had some sabbatical time, and I thought, well, how better a way to spread the message further than to write a book? And that's what I did. And it's been a wonderful ride.
And it's interesting that you do talk about this, about burnout and so forth. We just spoke with a former cancer survivor, I should say, who wrote his own book, and he goes around speaking to healthcare workers, talking about compassion and how a lot of compassion is lacking with healthcare professionals. And do you think that those two things are not mutually exclusive, that burnout then leads to a lack of compassion in some cases?
Absolutely. In fact, I think the two are self-propagating. Burnout, first of all, is a state of emotional and physical fatigue, which is caused by chronic stress. So we could talk a lot about the physiology and emotional aspects of chronic stress, but when physicians, just like others who are chronically stressed, are faced with decision-making and situations which warrant compassion, it's that fatigue from chronic stress that really mitigates our ability to, at least outwardly, behave with compassion. And so, yes, I think that's a sign of fatigue or burnout. That is the apparent lack of compassion. I think that almost all of we physicians went into medicine because of altruistic feelings, and I think we are compassionate people as a group, but certainly at times we can be worn down and exhausted, and in that case it may seem like we're not generating a lot of compassion.
Yeah, it's understandable, and particularly in the last year or so. You are a pediatric intensive care physician as well, so you, I would imagine, see some of the worst when illness afflicts some of the youngest, most innocent of patients. And so how do you then find either happiness or can lift yourself out of that situation when you do have patients who are so very vulnerable?
I decided when I went into critical care medicine and cardiac anesthesiology that if I was going to be dealing with a lot of sick and dying individuals and their families, I needed really to meet it head on. And that's exactly what I did. And I think that with the proper conditioning and training, we can actually use the experience of dealing with people who are very ill and what seems to be a very sad situation in a way that actually brings compassion, as we discussed, and also inspiration. So I personally feel very inspired by my families. I'm just constantly amazed at how well families and children deal with a variety of very serious congenital and other deformities and conditions. And so I find my patient population to be a constant source of inspiration rather than one that causes me to be depressed.
As a professor at the Stanford University Medical Center, what are you teaching your students? Are you also instructing them on how to locate that happiness?
Absolutely. I think it's a key part of being an effective physician. And again, being able to be compassionate, that requires that we are in touch with our inner source of happiness. And and also ability to be present in order to really listen to our patients and be present with our patients. Sometimes, certainly near the end of life for a child and what that means to a family, really all we can do is be present with them and listen and be sort of a beacon of peace and presence itself. And so that's what I aim to do, and that's certainly how I teach my medical students, residents, and fellows in the intensive care unit and in the operating room.
Why don't we take a break here? When we come back, I want you to describe the 4 steps to gain happiness and to describe just how the path to personal resilience and happiness happens. So let's do that in 2 minutes. Don't go anywhere. We've been chatting with Dr. Greg Hammer. He is the author of the Gain Without Pain, the Happiness Handbook for Healthcare Professionals. And we've just been talking about how healthcare workers, professionals, they have had a really tough time of it. And you can get really stressed out. And that sort of chips away from the original mission, if you will, that brought you into the medical profession. But maybe you could tell us what some of the 4 steps are to getting to that place.
Sure. Well, I think just kind of backing up a little bit, we all have 2 aspects of our personalities and the workings of our mind that we need to confront. And they are a negativity bias. So we tend to remember and focus on the negative and forget the positive. And the second thing is that we're rather obsessed with the past and the future in ways that are maladaptive. So while it's adaptive to think of the past in ways as a result of which we may savor our wonderful memories and learn from our mistakes, and it's adaptive to consider the future so that we can put bread on the table, as it were, and look forward to happy times. Beyond those thoughts, obsession with the past often brings shame and regret. And obsession with the future brings fear and anxiety. And coupled with our negativity bias, you can see where that would lead us to be exhausted and burnt out and perhaps depressed. So I think the solution is to learn how to rewire our minds, rewire our brains away from this negativity bias and away from the obsession with the past and the future toward being present, because let's face it, happiness lives in the present moment. If we think of all of our happiest times, they are when we are right there at that moment, when we're walking through a forest and just inspired by the tall trees and the sunlight filtering through the canopy, whether we're with a loved one having a magical moment. We're not really thinking about what's to come or what happened yesterday. And so how can we put ourselves more in a position to be positive and to be present? And this is where I think the 4 elements of GAIN come into play. It's very simple, really. I think that gratitude, acceptance, intention, and non-judgment are the 4 pillars of our spiritual wellness and the keys to rewiring our brains. So gratitude, I think that all doctrine and religious beliefs and philosophies acknowledge that gratitude is essential. You can be poor and happy, you could be physically debilitated and happy, but you'll never see somebody who's happy and ungrateful. So, we can all be grateful. Personally, I'm also a cancer survivor. I had rather poor prognosis at one point, and now I take an immunotherapy pill every morning, and I'm perfectly fine.
Wow.
And I expect to remain that way and die of old age in 30 or 40 years from now. So that's always...
But if I can interject here, when you talk about gratitude, and we heard this from our other guest as well, who was talking about compassion in the medical field, it releases chemicals within us that then makes us happy. And doing for others as well. Would you say that that's also a component?
Right. Absolutely. I mean, we can actually show that gratitude training improves our health. One way we can do that objectively is to look at the little protective caps on our chromosomes called telomeres. They're sort of like those little plastic coating at the end of our shoelaces that keep our shoelaces from fraying. The telomeres keep our chromosomes from fraying. And as we get older, our telomeres become shorter. And it's been actually shown in more than one study that gratitude training actually lengthens our telomeres. And so, as you suggested, we can look at chemicals in our body, dopamine, serotonin, other neurotransmitters that are increased when we focus on our gratitude. But certainly, I think it's intuitive as well that
That's
gratitude
right.
is essential to happiness.
Absolutely. Where can people find your book?
My book is on Amazon, and also they can go to my website at greghammermd.com.
Wonderful.
GregHammerMD.com, and there's a link to the book there, as well as a lot of media, and probably our chat today will be on that site as well in the future.
Fantastic. Well, Dr. Hammer, thank you so much for joining us today. Really
My
appreciate
pleasure.
it.
I'd be happy to join you anytime.
Love it. Thank you. We're back after this.
Thank you.